SMART goals is a mnemonic acronym that is used to help guide setting goals and setting clear objectives. It's incredibly helpful in the healthcare setting to use this for patients to promote the changes you wish to see in the patient population. So let's talk more about how you can implement SMART goals into your current practice to improve patient changes. Hi, I'm Catherine Anderton, the Clinical Product Analyst here at ThoroughCare. SMART goals are a great tool to use in healthcare, specifically with care management. They can help guide the criteria in setting goals for your patients and promoting positive patient changes. Let's dive into what SMART goals are and how it can benefit the care provided. They are specific, measurable, attainable, relevant, and time-based. First, SMART goals need to be specific. It needs to be clear what you're asking the patient to do. An example of this would be to lose 10 pounds in 2 months. Next is measurable. You want to ensure that you can measure the patient's success. So for this instance, we have 10 pounds. You can have the starting weight, which would be 170, and our goal is for them to be at 160 pounds. Next, we have attainable. It needs to be a goal that the patient can actually achieve. We don't want to set our patients up for failure. In addition to the goal being attainable, it also needs to be relevant to what's going on with the patient. Losing weight is very relevant in them managing their health. Lastly, it needs to be time-based. It needs to be clear on when you can start this goal and when our end date is that we should have hopefully met that goal. SMART goals are great to implement in your care plans and all care to patients because it's going to give them a bit more of a sense of direction and focus for them to get where they need to be and make the positive health changes. You can agree with the patient what they want to work on. You can document where they're at now, come up with a plan to get them to that ultimate goal, and monitor the progress along the way. Because as we know, change is not always linear. So that way you can see where the patient is today, tomorrow, and all throughout the whole process. It can help promote accountability on the patient's end to see those numbers, and some of that changes is positive. They can see that I did X, Y, and Z and it positively impacted this measurable data point. Or they can say, I did X, Y, and Z and it negatively impacted it, and they're less likely to do that in the future. If you'd like to learn more about SMART goals or how to implement them into your current practice, feel free to click the link below. And as always, feel free to like and follow to see more information like this.